Thank you very much. The next question, the member for Ottawa South.
Thank you very much, Mr. Speaker. My question is for the Premier. So we've seen how COVID-19 has disproportionately impacted our parents and grandparents living in Ontario's long-term care homes. And we also know that testing is critical to the management and containment of COVID-19. Our Chief Medical Officer of Health confirmed that in mid-March, Ontario was not utilizing its full testing capacity. This continued for about a month. Thousands and thousands and thousands of tests. So, through you, Speaker, to the Premier, we knew who was most vulnerable. Why did we not utilize that excess capacity to test staff and residents, at least in those homes that we knew were most at risk? Thank you, Speaker.
Premier.
Well, thank you very much. I want to thank the opposition for the question. Mr. Speaker, I don't know anyone down here in the legislature that was screaming louder than I was about increasing the testing. I want to thank our public health right across this province. They have stepped it up tremendously. They're doing an incredible job. They're going out there testing every single day. We're just shy of about 500,000 tests across the province. We're getting stronger. We're coming up with new apps when it comes to contact tracing and tracking. It's absolutely critical. That's part of it. But, Mr. Speaker, the good news is by probably early next week and hopefully sooner, we will have tested every single patient and healthcare worker in long-term care right across this province. We're going to continue doing that, working to seniors residents, and continue working. We will never stop testing, Mr. Speaker.
Thank you. The supplementary question.
Thank you, Speaker. I'd like to thank the Premier for his response, and it does lead into my supplementary. It's clear that frontline workers working in multiple facilities have continued to spread the virus. So this week in New York, Andrew Cuomo said, every worker, twice a week, not optional. So we haven't finished, it's almost mid-May, and we haven't finished our long-term care homes yet. We'll finish next week, and that's a good thing. That's just a start. We're going to be doing this for a while. So, Speaker, through to the Premier, what is the government's plan going forward? And I realize we've got a bigger plan for the community, but what is the plan going forward to ensure that residents in long-term care and staff, and in group homes as well, will have a testing protocol that will protect them? Thank you.
Mr. Premier.
Through you, Mr. Speaker, our first goal is to get through all the long-term care, get through all the senior residents, go through the group homes. And once we get through that, we reevaluate, and if we need to go again, we're going again. We're going to continue staying on this. We're going to continue testing. We're going to continue contact tracing. And again, you've seen where we were a few weeks ago compared to where we are now. Our goal for public health right across this province is to make sure we hit 20,000 every single day. And they're getting better and better. They're doing a great job. They're working around the clock. And I want to congratulate everyone, part of the health team, part of public health, right across this province.